Hello everyone. So we have a 22 months old girl is brought to you due to abdominal pain. Yesterday she developed severe intermittent abdominal pain and have been drawing up her legs when it occurs. The episode lasts for 15 to 20 minutes and are occurring more frequently today. The patient cries and screams during episode and does not vomit or have any other symptom. The appetite is decreased and her last bowel movement was 2 days ago. Patient began toilet training and normally passes soft stools daily in the toilet. Well, she attend daycare and has had 3 upper respiratory infection in this winter as well as gastroenteritis 2 weeks ago. Weight is at 35th percentile for age and abdominal tenderness and palpable cylindrical mass on the right side of the abdomen. Fecal occult is negative. Most likely triggering factor for this patient is, well, the answer is A, hypertrophic Peyer's patches. Why? This patient has intuicesception. How can we say? But first of all, let us learn what is intuicesception. Is the telescoping of one bowel segment into the lumen of other. Okay, I'll be showing you the picture very soon. Now, what are the risk factors for intuicesception? Recent viral infection or rotavirus vaccination. While in our case, there are episodes of upper respiratory infection as well as gastroenteritis. History is there. Congenital malformation of the intestine like Meckel's diverticulum, Henoch-Schönlein purpura, celiac disease, intestinal tumor, and polyps. They are some of the risk factors for intuicesception. Now, affected patient experience sudden episodic abdominal pain. That in this case, classically, there has so many episodes are there in just 2 days only. That progressively increases in frequency. If you can see in this in our question also, yesterday they were different and today the problem is more. Children may draw up their leg like in our patient to relieve the pain but act normally between the episode. So now this point is there in our question also. So we are getting episodic pain with increasing frequency with and the patient drawing up the legs. All these are there in our patient or the question. Stool may have blood and mucus, the red currant jelly from the bowel wall ischemia. Look, this is how the red currant jelly looks. Okay. Now the telescope bowel is occasionally palpable in the shape of a cylinder or sausage appearance. That what is there in our patient also. We are getting a mass in the abdomen. And in the ultrasound, we should look as a target sign. So let us see. Let us see target sign. Okay, this is the inner and this is the outer. Classical. Okay. Now let me tell you more about the outer hypoechoic edematous outer loop of bowel. And this is hypoechoic. This you can see. Hyperechoic compressed loop of bowel telescoping within. Now this you can see this it has been compressed inside. So this is the classical target sign that we see in intuicesception. This is ultrasonic finding. Okay, target sign. Now, most cases of intuicesception, up to 75% occur between 6 months to 2 years. In our case, it is 22 months. Okay, it fits into this. Following a viral illness, patient had 3 upper respiratory infection this winter as well as 2 gastroenteritis 2 weeks ago. That again fits into our diagnosis. And they have no identified any other lead point. Well, the previous history of gastroenteritis thought to cause a hypertrophy of the Peyer's patches in the lymphoid-rich terminal ileum, thereby serving as a nidus for telescoping. So it's the hypertrophy of the Peyer's patches which is acting as a nidus for telescoping. Treatment is with air or saline enema, under sonographic or fluoroscopic guidance. Surgery is indicated if enema does not reduce the intuicesception or imaging suggests a mass lesion. But in this case, this should do the job. As far as option C is concerned, this is a small bowel diverticulum. Interception in older children should raise concern for a pathological lead point, especially in the setting of recurrence. Okay, remember, he's talking about older children. When we talked about young pediatric age group. Mecal diverticulum is the most common congenital gastrointestinal anomaly that can serve as a lead point in the older. The patient can be asymptomatic until the diverticulum is caught and dragged into the under bowel segment during peristalsis. What about option B, insufficient stool? If this occurs in cystic fibrosis, can occur as a lead point due to inability to intestine to propel viscous stool effectively. Patient has no symptom of cystic fibrosis like recurrent lower respiratory tract infection, poor growth, steatorrhea, nothing is there, and has normal stool consistency. So this is automatically ruled out. Okay, and option E, small bowel wall hematoma. Henox-tolerant purpura increase the risk of intuicesception due to formation of small bowel hematoma from the autoimmune vasculitis. Palpable purpura and joint pain are usually the first manifestation of this condition. But now I have a question for you. Stop the video, write down the answer in your copy. In this palpable purpura, they talk something about, in henox-tolerant purpura, palpable purpura they talked about. Now my question is, what is palpable purpura? Write down the answer in your copy. Well, it is skin overlying the vasculitis is non-blanching, hemorrhagic, raised and painful to palpation. It is also known as tumor of acute inflammation. It indicates some sort of vasculitis secondary to a serious disease. Histologically, this what we call a LCV is, or so-called palpable purpura, is characterized by leukocytoclasis, okay, which refer to vascular damage caused by nuclear debris from the infiltrating neutrophil. So LCV stands for leukocytoclasis vasculitis. Okay, so it's all due to nuclear debris of the damaged neutrophils. Now look into this classically. They are usually more common in the leg areas. Well, in addition to that, in HSV, you should note down platelet count is normal. P for platelet, N for normal. This is normal. And they are cum test is negative. That means nothing to do with any antibodies. Okay, cum test is negative in this case, and platelet count is, and there is no thumb. And in addition, as I told you, patient can have pain abdomen, joint bleeding is a feature. Golden line to remember, most cases of intuicesception occur at the age of 6 months to 2 years. Of course, this we are talking in the pediatric age group. Following a viral illness, 75% patient they fit into this category in this age group. The resultant hypertrophy of the Peyer's patches in the lymphoid terminal ileum serve as an ideal for telescoping. A pathological lead point should be suspected in older children with recurrent intuicesception. In older children, Meckel's diverticulum is a very common cause. Thank you very much.